Okay, awesome. Yeah, so good afternoon, everyone. I hope everyone is having an amazing Monday. I'm glad that everyone is able to make it here today. And so, welcome to the Health Talk event, where we're joined by doctors and health professionals from John Muir Health and Kaiser Permanente to clarify any doubts and answer lingering questions that we might have regarding the vaccine and COVID-19. And so, without further ado, I'll be passing this on to Lauren to get us started with the speaker introductions. So, Lauren, the stage is yours.
Hi, everybody. I'm Lauren Theodoropoulos. And so today we have here with us today is Dr. Clifford Quan, who is the Chief of Infectious Disease at Kaiser Permanente. And we also have Dr. David Griffith, and he is the Emergency Department Director at John Muir Healthcare. So if you guys want to share some background about yourselves, that would be great. Thank you guys so much for being here today.
Sure. Dr. Quan, you want to go first?
No, go ahead.
Sure. So my name is Dave Griffith. I'm an ER physician. Been practicing here in the area for about 10 years. My family's been here, and I personally grew up in San Francisco. My roots have been in Brentwood and Antioch, where my grandparents grew up. So long ties to the area, although I was out of the area for medical training for probably 15 years. But I've been John Muir now for about 10 years, and I'm happy to be here and answer any of your questions.
I'm Cliff Quan. I'm an infectious disease physician. I've been here at Kaiser in the Diablo service area for now 11 years, I think going on 12 years. Grew up in Sacramento, did school up here in the Bay Area, went down to LA to train. Didn't like LA very much, so I came back up here to Northern California, where Kaiser was happy enough to accept me, and I'm privileged to be working for Kaiser in the area. Looking forward to speaking with all of you.
Thank you guys so much for being here today. I know everybody's really excited to hear what you guys have in store about COVID-19. So, Stephen, should we get started on the presentation?
Yes.
All right, so my understanding is the first few slides are mine. Some sobering yet very hopeful statistics about COVID-19 in the United States and in California. As you all know, SARS-CoV-2 is a coronavirus that's circulating worldwide. Strangely, much more virulent or much more active than prior coronaviruses that we used to see. We've seen about 755,000 deaths in the US, 72,000 here in California. But the good news is that we're progressing very well with the vaccinations. In certain areas of the country, we could be doing better. In California, we're doing quite well. Aside from certain pockets in California that still are lagging a little bit. We have about 45 million vaccinations given in California, and more people are qualifying for the vaccine. We do know that folks with underlying medical conditions and those who are of older age do tend to get worse disease. But what we have found most recently with the Delta variant is that it doesn't seem to discriminate as much. And even young, healthy individuals can get severe COVID. And we have seen some deaths among them. Next slide, please. What we've seen in this pandemic is some remarkable science that has produced some really good vaccinations. And these vaccines, there have been a lot of rumors around about, well, how well were they studied? Were there shortcuts taken? Are there things to be concerned about that we haven't seen before? And the truth of the matter is that all the vaccines have gone through a rigorous testing process. And what is different about these vaccines compared to ones that were done previously were that most studies, most medications, most vaccines need to go through a 3-step process to prove 1, that they're safe, 2, that they're effective, and 3, how effective they are. And what most companies will do is they'll take each step one by one because they don't want to put in enough money to go through all 3 steps together. Because if one of those steps fails, the product fails. The difference with this vaccine was the urgency that we needed to have good therapeutics and vaccinations to prevent this pandemic. And what the government did was they funded all 3 steps to be run simultaneously. And so there were periods of time where the first process got going, and then they started the second process while the first process was still going. And then they did step 3 while step 2 was still going. And that allowed the vaccine manufacturers to really speed up the process of getting the vaccine approved. Now, again, the vaccines did go through all 3 steps, and they completed all 3 steps, which is why they were granted the emergency use authorization. And the reason why it was emergency use was because most of these studies to get full FDA approval need a longer period to look for side effects. Pfizer actually reached that point recently, so they have full FDA approval for their vaccinations. But it just goes to show that the rigor that we require of these vaccines to go through was completed and was done very well. How do these vaccines work? Well, there are 3 approved vaccines in the United States. There are 2 mRNA vaccines. This is the Moderna and the Pfizer BioNTech. The mRNA vaccines essentially just give our bodies instructions. They give our bodies instructions on how to make one part of the coronavirus so that our body can make that part and then react to it because our body sees it as foreign. And so what we're giving our bodies with this vaccine is not the complete virus. So that's why it cannot make you sick. It's essentially like if I gave you, if I taught you, for instance, how to dye your hair green. I can't tell you how to dye the rest of your body green. I just tell you how to dye your hair green. So the only part that I'm giving you is how to dye your hair green. If you wanted to learn how to dye the whole body green, well, I'm not giving you those instructions. And so you're stuck with green hair. So the vaccine is similar. We're only giving your body the instructions how to make that protein, that spike protein. But we're not giving the body the instructions on how to make the whole coronavirus. And so when your body reacts, it is reacting to that spike protein to protect you, but it will not make you sick because you're not getting the instructions for the rest of the virus. Next slide, please.
Can I point out one thing quickly
yeah,
about that as well? Is that in my discussions with patients, I know one thing they tend not to kind of grasp is that the virus itself typically is injecting its DNA into your cell and using the machinery in your cell to recreate itself. So the virus is giving more instructions to your body's cells. So that whole process is essentially been abridged or shortened to only allow the production of this spike protein. So it's not necessarily a whole different process than what the virus would do kind of normally. It's just been kind of truncated in some ways.
Yeah, that's a good point. Now, the Johnson & Johnson vaccine, as well as the AstraZeneca, though AstraZeneca is not approved in the US, Johnson & Johnson uses a slightly different method of delivery. It still only gives instructions for the spike protein. But the way that we deliver those instructions is through the body of a different common cold virus, an adenovirus. So the adenovirus just basically is our delivery system. And we're giving the instructions, again, just to the spike protein through this adenovirus. It's just a method of introducing it into our body. Similarly, it is just the spike protein. It is not the entire virus. So your body cannot create that virus again. It can only create that spike protein. And that's what our body is reacting to. That's what's protecting us with these vaccines. So it won't alter your DNA. It won't make you sick from COVID. It is really, and you can't pass it on again because you're just given the spike protein. All right, next slide. So what do we know about the vaccines thus far? We know they're safe. We know that they work really, really well, and they don't give you the infection. After getting vaccinated, the CDC says you're much less likely to pass on anything if you do get infected. That's where they've rolled out these guidelines that if you're fully vaccinated, you have a bit more freedom to go about your daily business as we used to do. It can be used. Oh, sorry, I'm getting a call. Give me 1 second. The vaccines can be used in pregnancy. They can be used in patients who are breastfeeding. They've been shown to be safe in both. And they've been shown to be helpful in immunocompromised patients. So all realms of individuals age 5 and up now have been authorized to receive these vaccinations. All right, I'll hand it over to Dr. Griffith. I believe he has the next slides.
Great, thank you very much. And one thing that I often start when talking with patients is a little bit the elephant in the room, is that a lot of people don't know people who've been sick or have gotten really ill, and so I think it's hard for them to kind of conceptualize or visualize the risk. For those of us who take care of patients on a daily basis and kind of see and experience the kind of consequences, and we've taken care of children that have had really bad outcomes, young adults, and certainly a lot of folks that are kind of 50 and above who've had really bad outcomes. So it's hard for people, I think, to kind of grasp the danger or risk. And I think as humans, we're not great at doing that sometimes. I just wanted to kind of acknowledge that even though you may not know someone directly, I think the risk is still there. And there's really a benefit to kind of other people other than yourself. So, and we'll talk about that maybe in a little bit. What I see in the emergency room a lot are people who present with what they think are kind of side effects from the vaccines, but these are really anticipated side effects. So from the first dose, typically a sore arm, and people, I got the vaccine almost a year ago. So in just middle of December, as soon as it became available, my wife got the Johnson & Johnson because that's what she wanted. And I have 2 children that were 12 and 14. And as soon as they were available, they went and got their vaccine as well. And all of us essentially had pretty sore arms. And that's the hallmark. You can get some mild symptoms, which I describe as flu-like symptoms, not feeling well, out of sorts, fatigue, sometimes a little nausea or headache. Those are more prominent after the second dose, or maybe for 1 or 2 days, you feel just a little bit off. The most common side effects really are fatigue. If you look at others, headache and chills, maybe about 5 to 10% get actual fever. But it's generally flu-like symptoms last a day or 2, and then there's really nothing after that. These side effects generally indicate that your body is kind of reacting to the vaccine in a way that is anticipated and in some ways desired, because it shows that your body is producing a kind of immune response as we are hoping that it will. And as Dr. Quan pointed out, these side effects do not mean that you have COVID, and that is a common question that we get from people. We can go to the next slide. The questions I hear from people is that people get vaccinated and they can still, get COVID. The point of the vaccines essentially is to prevent hospitalizations and death. And what we're seeing at this point is, within the health system, that over 90% of the people that are now being admitted to the hospital who are really sick are people that are unvaccinated. And the breakthroughs that we see of people that get admitted to the hospital tend to be people that are very elderly, so 70 and above, or very immunosuppressed, and they take medications that suppress their immune system. So the vaccine never really had a chance to kind of develop the antibodies that you would need to show protection. But there are definitely a decrease in people that are vaccinated that get admitted to the hospital. That's very palpable. And I just want people to be kind of aware of that. These vaccines are very, very effective, and they've been effective for the variants that we have currently. And the question kind of going forward is, if we have further variants, how effective they will be. And I think we don't know the answers to those questions, but so far the data is very encouraging that these are very effective vaccines. People that are unvaccinated are much more likely to die or pass away from COVID. And we've seen over the last 6 months that the fraction of patients being admitted to the hospital, the demographic has shifted younger in age. So we're seeing a lot more people that are younger because they're unvaccinated and potentially have more exposure and more risk versus in the early wave, the majority of people we saw that were elderly, 60 and above. Now we have a fair number of people that are in their 30s, 40s, and 50s. Go to the next slide. There's a question about boosters. That's I think we're having a conversation about, vaccines. We're just trying to get through, probably get over the first hurdles versus maybe the down the line hurdles about boosters. With all immune responses, or most immune responses, we don't really know how long our bodies have memory of that infection and kind of be prepared to meet it at the next occasion. During our childhood, we're given vaccines. Often you get the same vaccine a couple times in a row to help really boost your immune response. And that's why you get a tetanus shot every 10 years, while pertussis is kind of, you want to get a booster at some point later on. So it's a very common process. We don't really know as to what degree our immunity kind of wavers over time. And so this was done as a precaution, really for those who are most at risk. So the elderly, those who live in care facilities, those who have chronic underlying medical issues, and those who are high risk. So like healthcare providers that have frequent contact with people with COVID. But that is open to more people, and they've kind of continually opened that. So my wife, who had the Johnson & Johnson vaccine, just recently got her Moderna booster. So there are options to kind of improve your immunity, and that's available to you as well. And one of the other questions that comes up a lot is the kind of the concept of like, why, if there's not a huge risk to me personally, why should I get vaccinated? I think there's several reasons. I mean, there is a risk to everybody. And I think if you're younger, which predominant, I think the audience here is predominantly younger, so the risk to you is low. But I think the service to essentially the community in terms of giving protection to the elderly who may have been vaccinated, but may not able to form, great protection from that vaccine, or people who have like chronic medical disease, as much as we can protect the rest of the people in the community, I think it's very helpful. And so people always ask, well, what does it take to get to say herd immunity? Like what percentage do we get to? Because Contra Costa is pretty high. The immunization rate, I think, of full vaccination is around 75%, and of at least a single dose is up to 80%. And I don't think people know what the herd immunity level is. It depends on how infectious the disease is. And Dr. Quan would know more about this myself, but certain diseases like measles that are very contagious, you have to have a very high percentage of the population protected. And diseases that are less contagious, you need slightly lower. But I think most people think that you need somewhere around 85 or 90% of the community protected to have some group protection against the infection. We go to the next slide. So what are the key points? The key points is that the vaccines are safe. So in the ER and in every ER, we have a sheet on the board. There's a whole system to report what you think are kind of complications. So this is something that's been monitored from the very beginning at essentially every emergency room, where there's a mechanism to report everything. And we are really not seeing complications from this. In the last, essentially year, I'm only aware of one outcome, and we've seen more side effects. The biggest concern would be for anaphylaxis, which is very, very low. It's probably in the rate of 1 in 100,000. There's different numbers out there, but exceedingly low. So that's very encouraging. So very serious side effects are extremely rare. Variants will continue to circulate. We want to basically protect the vulnerable in our society. And the only way you can really probably move steps or take a step forward to kind of living a life that's a lot more normal is if we get to that herd level of immunity. We still will need some masking hygiene to help kind of mitigate the risk of spread, because I think some people with vaccination will still get illness. Hopefully the illness will be less severe, and hopefully the illness will be shorter, and that their infectivity will be less than you would see otherwise. We can go to the next slide. I think that may be the end. And there's some resources there. And I think we can probably open it up to questions.
Well, thank you, David Griffith and Dr. Quan, for sharing your guys' insight about COVID-19 and how it's actually effective. And we should be getting vaccinated. Now we're going to open the floor up for questions. If anybody wants to put them in the chat or just raise your hand, you guys can do so.
Can I just come in and ask a question? Hello?
Sure.
Yeah,
Sure. Just wondered. I was just kind of reading along when you had the slides, and it said that you can take a booster shot maybe 6 months after having your two Pfizer shots. Does it have to be? I mean, if you've had your shot, does it necessarily have to be 6 months before you get your booster?
Yeah, I think a lot of the data, a lot of the recommendations are based on the data. So the data was collected around the 6 month interval. And so that's the basis for the recommendation. There's no hard number to say you can't get it, say 8 months after. For instance, a lot of the healthcare workers who got their first shots in December when they first rolled out were well into their 8th month when they got their booster. I think what they're recommending is based on the science that you have a minimum of 6 months between when you finished your series and when you get your next booster.
Okay.
The science does support that 6 month interval. The reason why they put it at 6 months was that they've started to notice that that's when your immune system starts to not protect you as well. And the reason why that is important is because, one, it increases your risk of getting sick. But keep in mind that the vaccines still protect you from getting seriously ill, and it prevents you from dying, right? So the vaccines are still really good if you don't get the booster from keeping you from getting really sick and dying. But a booster will protect you from, one, potentially getting sick at all, two, getting sick enough to pass it on to anybody. And those are the other benefits that we're looking at. We're looking at like community benefit in terms of, as well as individual benefit.
Okay, because I'm not one of the younger students, because I'm getting boosted tomorrow, and I think it's been about I'm scheduled for tomorrow, but I think it's been about 6 months. I might be right in there. I was just checking.
Yeah.
But I'm all for it. I appreciate you both, though. Thank you.
Yeah.
I see in the chat, there's some questions, which I'll just maybe read, and Dr. Quan, maybe you're able to help answer some of these. So a common one is, if I've already had COVID or if I have antibodies, should I still get vaccinated? And my response has always been that would be yes, but there are some benefits. I think the benefits, I usually put it into 3 categories. One is when you have natural infection, we don't know to what degree you're going to form antibodies that are protective. 2, I think there are some studies that suggest that if you get vaccinated on top of having natural infection, your protection immunity is much higher. And then 3, I was worried there's a number of people that say they think they had COVID or believe they had COVID and really have no idea if they actually did. So they may have a false impression that they're actually protected when they're not.
Yeah, and I would agree with that. I think part of the concern about natural immunity is exactly what Dr. Griffith says. Some of the studies show that if you did get infected and you did create antibody, your antibody levels may drop off a little bit faster than if you were vaccinated, say. And that's important, again, because of your risk of getting sick with the new variants. There's some studies out there that says if you were infected with the earlier strains of COVID, that may not protect you from the Delta variant. And you may get sick from the Delta variant in a more severe capacity than if you were, say, vaccinated. So the vaccinations have shown protective even for the Delta variants, whereas natural immunity, there's some question about how well it protects you from natural immunity. And to Dr. Griffith's point, if you were infected and then you got vaccinated, the data does show that you have a very strong response to the vaccine. I like to kind of think of it as you're kind of super responsive to the vaccine, which is excellent. Your antibody levels go really, really high, even more so if you just got vaccinated or if you just got infected. So there are definitely benefits to getting vaccinated, even if you previously had the infection.
There was a question about the flu shot. So you can get the flu shot and the COVID shot at the same time. That's how our clinics at the health system are set up. I got mine at the same time. So that is an option.
I see a question up there. What is the most effective way to convince someone to get fully vaccinated? I think that's challenging because there's a lot of different information out there that can influence an individual's choice to get vaccinated or not get vaccinated. You've heard of some rumors about microchips, and this was a rumor that started because Bill Gates, I believe, was talking about having electronic passports actually to prove that you were vaccinated, but some people thought, well, it must mean there's a microchip in there. So it's really hard to say what the best way to convince someone to get a vaccine is. What I like to point to is the science, the data, that you can't really make up the data. And as Dr. Griffith pointed out, and what we've seen in our hospital as well, is particularly in the last surge, you could guess what the vaccination status was of all the patients who got admitted to the hospital, because vast majority of them were unvaccinated. So the people who were getting really sick, the people that we were losing in the hospital, were those who were unvaccinated. And so addressing the hesitancy is a little bit difficult, but the data is really good. The data about the effectiveness of vaccines are really, really robust.
I find that when you're talking to people and trying to, quote, convince them, I mean, I never feel like I'm going to convince someone. Someone has to essentially come to it on their own. So much like when I talk about smoking or other kind of habits that are maybe not ideal for the health, I usually ask, what do you like about smoking, or what do you like about drinking? Just to kind of engage in discussion that's maybe a little bit more honest and balanced. So, what do you enjoy about not being vaccinated, or what does that mean to you to not be vaccinated? Because I think a lot of it, people have personal health beliefs or they have fears. And if I can answer questions, then maybe that helps someone along. But there's no way that I can probably reliably convince someone who is, very, strongly have beliefs they don't really want it, or they've been told that they have these, reasons that they shouldn't get it. And, a little, unfortunately, has been, politicized. And, as much as we can, we try to just go back to the science. And, I tell a lot of, even our nurses had questions. I said, well, are you nervous about getting the vaccine? And I said, well, I'm trusting that the science engineers did their work, much like I trust the science engineers when I get in an airplane. Like, I have no idea how an airplane works. I've taken, many other vaccines. I don't really know what's in them, right? I mean, I just kind of, there's a lot of trust that goes on in life that we don't question. And I think that all of a sudden we're questioning risk here, but we haven't questioned risk in many other areas of our life. And the question is kind of, why is that and how does that happen? But it's very interesting to have conversations with people, particularly people that are sick and unvaccinated. You kind of have these conversations with them and they're kind of like, I wish I knew. And the problem is a lot of people just don't know. They don't have that personal experience of someone in their family dying or being really ill. But those people who have, kind of their tone and their perspective changes a fair amount. And how do we share those experiences that patients have had, that have died and that have or been really, really ill, and to other people that would probably never have that experience? Because personally, in my family life, I only know my good friend from med school, her father died from COVID. But everyone else in the Bay Area I know has been super paranoid and really masked and doing everything and just really, really safe. And I don't really know that many people in my personal life who have had it. So I think that could be easily an experience for a lot of people that are here today.
Thank you very much. I think we still have some questions down in the chat below, so maybe Dr. Griffith or Dr. Quan could answer this one. So after,
oh yeah, go ahead.
Oh, sorry.
Go ahead.
Oh yeah, so the question is, after getting COVID, I lost my sense of taste and smell. I was wondering if there is any new information on when I can expect to get it back. Maybe Dr. Quan or Dr. Griffith would like to start with to answer this question.
I don't know the answer.
I was hoping Dr. Griffith has seen it more than I have. I don't know that there's an absolute time frame. I know that there are certain smell rehabilitation exercises that can be done. It sounds a little odd, but there are certain smell retraining that can be done to try and help move that process along. I was trying to look on our internal website, the kp.org website, to see if it was listed there, because I remember seeing one of our head and neck surgeons put out some information about that, and we can try and get that information to your leadership to pass it along. But to the best of my knowledge, there's no absolute medication or therapeutic that is going to turn that back on. But there may be some exercises that you can do to retrain your smell.
Yeah, for me, that brings up another kind of good point about that I try to make with people is that, there are risks associated with taking a vaccine. Like there's a risk with every medication. But if you can weigh that against the risk of, say, getting COVID, I mean, some people really have pretty profound problems from COVID that if they survive. So, I think we may take for granted our smell and taste. I think we don't realize how valuable those senses are. But there's a lot of problems with your heart and your lungs, which can last for a very long time. We don't really know what the recovery is because we're still early in this process.
It's definitely, I guess people have different responses, so it's pretty hard to kind of get an estimation. But yeah, thank you very much for the answer for that one. So we have another question as well from Tim Young. If we get closer to managing this virus, are there any complications of combining future COVID booster shots and annual flu shots? So we will just receive one shot annually. Maybe Dr. Griffith.
Well, I mean, I can share my perspective, and those are two things that get confused a lot when I talk to patients. Is for the flu, why do I have to get a boost? Why do I have to get a flu shot every year? And for COVID, now I'm seeing I'm getting a couple of shots. Is that can become like a yearly thing like the flu? And the flu is a different virus. It essentially changes every year. So you have to recreate a new vaccine every year. We don't really know with COVID how long immunity is going to last. So it may be that you get your initial series and you get one booster, and it may be, we don't know, like tetanus, maybe it's every 10 years you need a booster, or maybe it ends up they have to be yearly, in which case you could entertain some options of combining things. But I just don't think we know to what frequency you would have to give COVID boosters. It all depends a little bit on our bodies and what the immunity does, and then what variants come along down the road.
Yeah, almost. Dr. Quan, do you want to answer this question or smell retaining?
Yeah, I mean, ideally, to simplify things, all right, having a combined shot would be great. What we didn't know at the beginning of the pandemic and the vaccine rollout was whether or not vaccines would interact with each other. And so at the beginning, there was this question or this recommendation to separate all vaccines by at least 2 weeks, so that if there were any interactions, we wouldn't run into them. That recommendation has changed recently, where COVID vaccination can be administered with the flu vaccination without a problem. So I anticipate going forward, we would see it similarly, that co-administration of vaccines shouldn't be an issue. The interesting question, I think, is, well, can you get a combined vaccine like we do with tetanus and pertussis and that sort of thing? And I honestly think that's a manufacturing question that I would love an answer to as well, because I think part of the difficulty we have in medicine in general is the harder we make things for people, the harder it is for our patients to comply. And we want to make things as easy as possible for all of our patients, so that we can keep them healthy as best we can. I posted some articles on there about smell retraining. Again, it's not elegant, and it's not as quick as, say, taking a pill or so. But there are benefits, and there are ways of trying to get that smell back sooner.
And my impression, talking about giving 2 vaccines at once, was that early on, one of the other reasons for wanting to do that was that you wanted to know if someone was having some bad reaction, what you could attribute it to. So you just wanted it as clean as possible. So if you're giving 2 vaccines, you could always have an allergic reaction to your other vaccine or some side effects. You just wouldn't know. Because it was new, I think they were separating it out. And now we've seen that the vaccines are so safe, like we don't really see like severe reactions to any higher degree than you would otherwise expect from any other medication. So I think they've kind of relaxed that a little bit.
There was a question that was sent out a little bit earlier. Somebody had a question about, should I get PCR tested even if I'm vaccinated? And I think that's a really good question, and deserves some clarification. When you're testing for an infection, and Dr. Griffith knows this probably, the mechanics of this better than I do, but when you are testing for infection, so if you have symptoms where you think you were exposed, you want to get a PCR test to help determine whether you were infected or whether you are currently infected. And the PCR test will help determine that. Basically, what a PCR test is, it detects pieces of the virus that you get from, say, a nasal swab. And if you can find pieces of the virus on that nasal swab test, then it shows that you were exposed to that virus at some point. If you actually have symptoms and you test positive, then we generally associate the two together. We think that's a recent infection. It's probably active COVID infection. And the reason why it's important from that standpoint is we do want you to protect yourself. We do want you to protect those around you and seek care if you feel ill. There are other medications out there that we can use to kind of minimize the symptoms of COVID as best we can. And there are some newer medicines coming out that might work really, really well in terms of treating patients with early COVID infection. So the PCR test is helpful in determining whether or not you may have a current infection. The vaccine itself doesn't change that test at all. So if you get the vaccine, it won't turn your PCR test positive. So you can reliably look at a positive test as a true exposure event at some point.
Thank you so much, Dr. Quan. I think we're gonna transition into different questions that we have prepared as well. But thank you guys so much for answering everybody's questions in the chat. If you guys still have more questions, feel free to leave more comments in the chat. But here, if you guys want to each take turns answering the questions. The first one is, are there any long-term effects of the vaccine that I should be worried about?
I don't have any concerns for long-term effects from the vaccine. My 7-year-old nephew is getting vaccinated today. I got both my daughters vaccinated as soon as I could. So, I believe, I'm not going to put my family at risk if I thought that was risky. So, the happiest day for me was when my mom, who's a lot older, got vaccinated, and I felt like I was going to be the biggest vector in the world, because I'm taking care of COVID people every day. When it first started, and I kind of thought, I'm not really sure how I'm going to do. I had my cousin who's an ER doctor up north. His partner was in his 40s, got COVID, was on a ventilator, was on ECMO. Really, really sick. So you hear about those things, you get really scared. And all of us went to work. We thought, we could get it and really not do well. So we were super scared until we learned that actually, when we mask and we glove, that really works. When you mask and glove, it worked. We took care of, intubated COVID people, took care of them every day. And then the rates, we had not a single physician in our group got COVID at work. The only one physician that got it from a social contact outside of work. So I just know that those protective measures really, really do work. So, for the vaccine, I signed my kids up and I'm, happily vaccinated. So.
Well, that's good to hear. I'm also vaccinated, so I know I feel a lot better. Everyone's super worried about it. But Dr. Quan, do you want to go?
Yeah, most of the side effects that are reported for vaccines in general happen within the first 1 or 2 months of getting vaccinated. And so with the vaccines having been out as long as they have been, we really have looked at and seen that there really are not a lot of long-term effects. Key point though is that if you do get infected with COVID, there have been lots of reports of potentially long-term effects like fatigue and tiredness and loss of smell, obviously. So I think if you look at the balance, we're much more in favor in terms of side effects and risk in giving people the vaccines than not. To Dr. Griffith's point, I have kids of my own, and my youngest is 5, and I have a 5 and 11-year-old who didn't qualify for vaccine until a week ago, and they were amongst the first in line to get their vaccines. My entire family is vaccinated, and my parents and my in-laws are all vaccinated. And so, we may be a little bit biased for what we see, but for good reason. We see a lot of terrible things that have happened to COVID patients, and even the ones who recover. It's one thing to read news reports about patients who regret not having vaccinations, but when you get a chance to sit down with these folks and talk to them and trying to understand what their hesitancy is and what their regrets are, for that matter. They're fortunate enough to have regrets, but some of our folks are not. So I think you'll find big believers amongst most of, like in our Kaiser system, I think 99% of our physicians are vaccinated. I think there's a healthy fear amongst us that we want to make sure we protect ourselves, protect our families, and protect our neighbors.
Thank you. Yeah, it definitely seems a lot more rewarding to be vaccinated than just not be. All right, so for the next question, how far away are we from reaching herd immunity? And once herd immunity is met, should I still get vaccinated?
Dr. Griffith mentioned this before. I think the earliest, again, it really depends on how infectious the virus is. And the problem with herd immunity estimates is that they depend on us feeling like everything that happens is static, nothing changes, right? So I can give you a herd immunity estimate today, but the problem is herd immunity depends on how long that immunity lasts, and we just don't know. Especially in those who got sick, their immunity wanes over time and may be faster than those who were vaccinated. Put on top of that a new variant that comes out that is even more infectious. So you need even more people to get vaccinated. That target is just moving all the time. And day to day, that number may change because people are relying on natural immunity versus, say, vaccine immunity, right? And so I think it's hard to know. I think you're looking at a target that was already mentioned by Dr. Griffith, probably upwards of 90% of the people at any given point in time, right? At the same time, 90% of people have to be immune, right? And so, and that would have to happen for a period of time. And because our immunity wanes, it's a really hard target to get to. If we did meet herd immunity, is there a reason to get vaccinated? And this comes back down to individual protection, right? Because you want to protect yourself. Just because there's herd immunity doesn't necessarily mean that you are at zero risk of getting infected. And if you do get infected, then you're at risk of all the bad things that can happen. So vaccination is something that gives you some confidence that you yourself are protected. At the same time, it can also give you some confidence that you're protecting those around you. And that's really important as well, because a lot of us probably have friends or family that are at risk. They're not the healthiest people in the world, and they need a little additional help.
Well, thank you so much. I know I definitely have people that would be at risk too in my family. But moving on, or unless Dr. Griffith, if you want to say anything about it, you don't have to.
So the only thing I would point out is that, you know, vaccine mandates actually go back probably over, I think, over 100 years. So people have been kind of working with vaccines, and they've had mandates in place, particularly in states and schools, for measles and polio. And you know what they found was that when the vaccination rates got high, the disease started to go down, and then everyone stopped getting vaccinated, and then it would kind of come back. So I had to institute these mandates just to kind of try to keep the immunity level high enough in the community to make sure that disease didn't come back or cause problems. So, I mean, the same thing is here. You know, you think that, oh, if we get to, you know, 90%, is that good enough? Can we, like, you know, say we're done? Or, you know, I think then everyone becomes complacent. The number, you know, trickles down. You get less immunity. You know, there's new variants that come back. So I think that just if the community at large is kind of vigilant and everyone kind of does enough to protect themselves and others, I think if we, you know, push higher, I think the better off we'll be.
Okay, thank you so much. Like, such as people following like precautions and stuff with wearing gloves and masks.
The gloves and masks I was really meaning for like when we do high risk procedures in the hospital. I think that is we will have to discover what a world looks like when we have, you know, if we have 100% of people are vaccinated, or if you have 90% of people are vaccinated, what kind of rules do you have to have in place and to have safety? But you know, the benefits are great. Like you know, my daughter her whole team is vaccinated. They can play soccer, and you know, they can have kind of a safe exchange, and they don't have to run around the field with masks the degree that we're playing soccer with masks. I mean, that's pretty unpleasant, right? So I think that, there's some places allow kind of indoor eating. You'll start to see that, some parts of life that we miss and we want back. You can go to other states and try to get that kind of openness. But you see that a lot of those places have had more open rules or kind of still slogging through higher volumes of sickness. In the Bay Area, the vaccination rates are so high, we're doing so well currently, that I think people get a little complacent and think, oh, I don't have to do my part, I don't have to participate, or I can kind of just wait on the sidelines. But I'm just trying to pull as many people kind of out of the sidelines to join us.
Yeah, that sounds great. It sounds like we're doing a pretty good job here in the Bay Area. But moving on, what would be someone's chances of having a severe allergic reaction, and how could they safely receive the COVID-19 vaccine if they had an allergic reaction to other vaccines in the past?
Depends a little bit on what their prior allergic reaction is. If it's hives versus true anaphylaxis, where it was more life-threatening and they required epinephrine. The numbers that I've seen for, I think it was the Kaiser one, where I did a little bit of trying to dig up some numbers, it was very, very low. It was like 1 in 100,000 of anaphylaxis. So a very low, extremely low rate. And the vast majority of those occurred within 15 minutes. So I think it was like 75% or 72% occurred within 15 minutes. And that's why if you get your shot, they want you to sit there at Safeway, which is where I got my booster, or wherever else CVS or your Kaiser, or if you're at the hospital, if you get it, they want you to stay there for 15 minutes so we can at least make sure you don't have that reaction. The good thing about that type of reaction is that it's something that we can treat, right? It's a very treatable condition. So. Thank
you so much. Maybe Dr. Quan?
Yeah, I mean, I've seen similar numbers. I've seen somewhere between a risk of a severe allergic reaction being 2 to 4 cases per million. So like 1 in 500,000, 1 in 250,000. So your risks are pretty low. The CDC did say that if you have an allergic to a reaction to other vaccines, you can check the component list. If they share component lists, then that would raise your possibility of an allergic reaction. But the list of components in each vaccines are not hard to find. And so you can actually pretty well narrow down if, say, you were allergic to the flu shot, but it has nothing in it that is similar to the COVID vaccine, then you don't have to worry about it. In addition to that, there are protections in place, as Dr. Griffith already mentioned, where we will monitor you for a good 15 minutes, 30 minutes, even if you have a history of an allergic reaction, just to make sure you don't develop that. And most of the worrisome allergic reactions happen within that time frame. So if it doesn't happen, then in all likelihood, you're going to be fine.
Okay, thank you guys so much. And also, the next question is you guys kind of addressed it somewhat just now, but what could someone do to minimize the vaccine after effects? And I know you guys talked about sitting and having patients wait so you guys can monitor them, but are there any other things that you guys do?
I don't know. I think of the vaccine after effects are basically it's doing what it's need to do, and I don't really want to slow that down anyway. So there's some recommendations that you aren't taking medications that will blunt that response, at least in theory, why they say maybe you shouldn't be taking some NSAIDs or acetaminophen afterwards. My symptoms were so mild that I didn't think to take anything. But
okay,
yeah. I think in terms of timing, the CDC provides some recommendations about this as well, where before the vaccine, they don't want you to take anything if you can help it, right? Because as Dr. Griffith mentioned, you don't want to blunt your response to it. And so if you take, say, Advil before you get the vaccine, you may not have as strong of a response to the vaccine is what the concern is. Now, afterwards, if you were to develop, significant enough pain or fevers or so that you needed to take medication, it is reasonable for you to get the medication. But as Dr. Griffith mentioned, ideally the symptoms are mild enough where hopefully you don't need any of it. And you want to maximize that response as much as possible. You don't want to interfere with that as if you can help it. But it is permissible to take something like Tylenol if you develop symptoms, if you need to.
And we plan, so like when you got your second shot, we plan to have everybody essentially off of work the day after, or not doing anything too strenuous, just in case you had more side effects. So you can plan it in your life if you want to make sure you're not taking a big test the next day or have some real important thing that you're doing, just because in case you don't feel great, you want to be able to rest. So.
Thank you guys so much for your info. Moving on, I know we have a question in the chat, but I'm going to come back to that and I'm going to stick to this list real quick. So the next question is, should we get the COVID-19 booster doses? I believe that's the third one.
There are certain populations of patients that are recommended to get the boosters, right? So I know our governor has requested that whoever wants the booster should be able to get the booster. And it's, from a public health standpoint, it may make some sense. I think from what the studies have shown us, it's a little bit more limited in who really should, based on the studies, get the boosters. I think the CDC put out some recommendations about those of older age, those with obesity or underlying medical conditions, frontline staff, as Dr. Griffith mentioned, people who are working with a lot of people. So if you happen to work in retail or you're around a lot of people with face-to-face contact, those patients should get the boosters. So not necessarily everybody should get the booster, at least not right now per the studies. But I think there may be some more information coming where it may be eventually universally recommended for everybody. The time frame is a little bit important though. There is a difference between getting a third shot because your immune system doesn't work and getting a booster, which is 6 months after you finish your initial series. Excuse me. So there is a little bit of a timing difference depending on which category you fit into.
Okay, thank you so much. To move on, after getting the vaccine, should I still do a routine PCR test?
I think that was what Dr. Quan was talking about earlier. I think that if you are symptomatic, it's probably useful to do the testing, but I don't know if they're talking about doing like a weekly screening test is probably not required. But if you are symptomatic or if you're concerned that you have COVID, then a test would be indicated. Because I think in the chat, there was a little bit of a secondary question is, if you are vaccinated, can you get COVID? You still can get COVID. But generally your symptoms are milder. You still can give it to other people. The thought is that you might be less likely to do so. So less viral load, less time at which you would be most contagious. So there's a thought that'd be reduced, but it doesn't go to zero. So, I mean, even if you are fully vaccinated, there are some other concerns in which case you would want to do testing.
Yeah, and to that question in the chat, the question itself was, there people who get vaccinated and still get COVID and can spread it? Is there studies that show what the percentage of people who are sick or risk to others that have been vaccinated? So I think the studies, the absolute numbers, they had a range. And so during the Delta surge, a lot of information came out and they were saying, well, the vaccine effectiveness is down to say 60 to 80% with the Delta variant. And so those are where your numbers are, where if you were vaccinated, there's a chance you may get sick. And then if you are sick, then you may be able to pass it on. But to Dr. Griffith's point, there are nuances to that, where if you're vaccinated and you're sick, you may not shed as much virus as somebody who's not vaccinated. So your risk of actually passing it on is still present, but it may be much less present than if you were unvaccinated. You are still unlikely to get very sick. I've heard a lot of concern about, well, if I get a breakthrough infection, does it mean the vaccine's not working? The vaccine still absolutely works, especially from keeping you from dying and getting into the hospital, right? Those numbers didn't change a whole lot. What numbers did change is whether you were going to come down with like symptoms, and you are a little bit higher risk of coming down with symptoms. And so that's where all this talk about breakthrough came by. But again, important to realize vaccinated individuals did not get sick or die like those who were unvaccinated. And as Dr. Griffith pointed out, you're much less likely to pass it on. There's some newer data that suggests that even if you got sick, your body contains it so well that you're less likely to pass it on to those around you.
Thank you so much for sharing. So for the last and final question we have is, what symptoms set COVID-19 apart from other common illnesses such as the flu? And I know you guys kind of touched on this, but I want to give a little more insight.
Well, it was easy over the last year and a half when everyone was quarantined. If you came in, you had a fever and you had like viral like symptoms, without you're going to have COVID, because we didn't see, there was like no flu, there was nothing else. But as the world opens up, we're now in a little bit of a gray zone because the world's opened up a little bit, and we're seeing more viral infections, so more colds, more RSV. Still not seeing a lot of flu, but you're seeing other viruses. And then now you're kind of stuck. If you're going to go to school, your kids are going to go to daycare, kind of like, who goes back? And like, do you know you don't have COVID or not have COVID? I mean, the kind of classic, loss of smell or taste is relatively specific, but a lot of people do not have that. So the problem, I think, for a lot of people from the beginning is that there's some people that are like essentially asymptomatic, and then there's other people who die, and there's like everyone in between. So you're kind of like, well, what tells you you have COVID? And it really just depends on how your body responds to it. So predominantly, you're seeing people with loss of smell or taste, which is not that common, but if you have it, is pretty suggestive that you have COVID. More commonly, you see people with GI symptoms. So I see people with like diarrhea, cough, trouble breathing, but less so, just kind of not feeling well, maybe low-grade fever. But it's the exact same things you might have with other viruses. So it's very hard from a symptom standpoint to tease it out, and it's why we kind of rely on testing to help sort out who's really at risk for spreading it, or for getting worse.
Thank you so much for answering. Oh.
Yeah, no problem. I would agree with what Dr. Griffith said. I think it's really hard to tell because the symptom range is so broad, and so many viruses give you the same thing. I think as we head into this winter season, where we're kind of in closer contact with other people and more viruses are going to be out there, I would just have you guys just take precautions, right? Take precautions, err on the side of protecting yourself and others if you come down with symptoms by presuming you may have COVID first. Get tested if you need to get tested. Just wash your hands really well. It turns out that washing your hands, covering your mouth when you're sneezy or coughy, really does protect a lot of people. So if you get in that scenario and you have to be around other people, wash your hands really well. Just make sure you do that well. Yeah.
I haven't had a cold in a year and a half. It's been amazing. I take care of sick people all the time. So I usually get pre-COVID, we were, I describe ER people as a little bit like Wild West. We're pretty not really afraid of a lot of things. So we probably don't take all the usual precautions that we should. We weren't really wearing masks routinely in the emergency room. I'd go into people that are coughing, have fever, I just kind of walk in the room, and we would all get sick, right? We'd all get colds and constantly colds, and it's been over the last year and a half. I don't know if our doctors, like if they relax the rules and said you don't have to wear a mask anymore, I'm not sure that the doctors are going to stop wearing them, because it's pretty nice not getting colds. So we'll see. I mean, in their personal life, when you're out and about, a different story. But it's been nice. The only upshot.
No, that sounds good. Thank you so much, guys, for answering the question. I think we have another question actually in the chat. What's your greatest fear about this upcoming flu season and the possibility of increased COVID cases?
My biggest fear is staffing. Like staffing is such a problem that I don't think people realize to what degree the health system is fragile. There's really not a lot of bandwidth to absorb big fluctuations in volume. So, for right now, we're really busy, but it's, more busy with kind of a lot of non-COVID things as the world wakes back up. So for me, it's just more, do we have enough nurses to take care of people? Do we have enough beds? Where's our overall volume going to be? And that's my biggest concern, is just, making sure that we can take care of everybody.
Yeah, I think in my case, it's very similar. I think, my worry is that we've been in this pandemic for nearly 2 years now, and a lot of people are tired. A lot of people are tired of being nervous. They're tired of wearing masks. They're tired of avoiding other people. They want to be together. And the holiday seasons, that's what the season is meant for, is to be around people. My concern about that is that the closer we congregate, the less we take precautions, the more fatigue we feel about protecting each other, the higher the risk that people are going to get sick. And we know flu kills people. We know COVID kills people. And as we see cases rise, as Dr. Griffith pointed out, it overwhelms our hospital system. And when it overwhelms our hospital system, people don't get the care that they deserve, right? And that, unfortunately, you saw it in places like, I can't even remember, I think it was Colorado that was overwhelmed, and Iowa, where they had to, triage people and choose who got care. And so that is a bit of my concern. Last year, it was just COVID. It was all COVID. This year, it looks like flu is going to be around. It looks like flu is going to contribute to the amount of people that are hospitalized. And so my greatest fear is that a lot more people are going to get sick. A lot more people may be hospitalized. Some people may die who don't need to go through any of it if we can maintain certain precautions. And vaccinate, for that matter.
Thank you so much for your insight. So I think we're a little past 2, and I think this is all that we have for this health panel and presentation. So thank you, Dr. David Griffith and Dr. Quan, for being here today and informing us about COVID-19 and how to prevent it. If you guys want to give a round of applause, that'd be super nice for the doctors. Thank you.
Thank you. You're very kind. No.
But I think that's it for our presentation today. Thank you guys so much for being here and writing questions and supporting.
Right. Hope you're all well. Thank you very much.
Thank you guys. Thank
Guys,
everybody.
thank you.
Have a great day.